Hi guys, so I wanted to reach out because due to COVID-19 restrictions at Tactile Medical, we have been asked to hold off on doing inpatient demos just to prevent the spread and keep the health and well-being of our patients, other clinicians, and team members as our top priority. With that being said, we still need to help and reach out to our patients that are trying to manage their condition at home throughout this crisis. So I wanted to reach out to go over the kind of basics of what we would talk about at an in-person demo to give you a good sense and feeling of what the Flexitouch Plus being used to treat upper extremity lymphedema. That way you can kind of have a baseline to look at. That way when we have a conversation, either a virtual meeting or a phone conversation, you may have developed some kind of questions that are specific to you, which can kind of focus our conversation based on what you've seen in this video. First thing I like to discuss with patients is why Flexitouch Plus and what it is. What's the point of it? You have been referred for it, most likely to treat your lymphedema, and this follows manual lymph drainage protocol, which is the technique that a therapist would use in the clinic when performing lymphatic massage. What that basically is, it is a methodology to help reroute lymph fluid that is not properly draining due to a compromised lymphatic system and rerouting it to other healthy lymph groups. For example, if I was treating my left arm for lymphedema, we would be moving that fluid across the chest to healthy lymph nodes in my right axillary region and down to the trunk to healthy lymph nodes in my lower abdominal and inguinal region. With that being said, we have two garments that a patient would wear during a treatment session with the Flexitouch Plus. So I'm going to show you those on me first. Step one would be your trunk garment. This is going to look like a pair of shorts. Another thing to note with all of these garments is they are not compression garments. So everything should be able to be put on very easily and come off easily. It should take very little effort. I want room between you and the garments so that the pump has room to inflate. Should not be a tight compression like a compression sleeve or compression stockings or compression bra. So the shorts are going to go on just like shorts. Pull up. And then this is going to wrap around. Mine are going to fit a little wonky since I am 9 months pregnant right this second. Just so you can see, these will fit like a pair of shorts, okay? This is actually where your therapy will begin because we treat the trunk first to help decongest these healthy inguinal and lower abdominal nodes, working from the center of your body down, which I'll go over in a little bit. Second garment is going to be your jacket. This is for my left side. So just to show you, this will pull up like a jacket sleeve. There's a black handle right here, which kind of helps you pull to bring this close to the chest wall. And then this is your zipper for your jacket. So this will just go over. And now you have both garments on. A couple key things that I like to point out to patients about the garment is I want you to notice all of these seams. Each one of these seams is an individual chamber. Another thing that I get questioned a lot on is, oh, am I just going to puff up like a blood pressure cuff and then deflate? No, each one of these chambers will inflate individually. So you can watch each chamber moving. As one inflates, the one behind it is going to be deflating. Always moving fluid up the body towards this trunk. So you can just keep following it. It's going to cycle back down based on the program that I'm using. So while a patient is typically feeling this, I go over the method of the madness for how Flexitouch Plus works. Another thing I utilize with patients is this How It Works brochure, which is going to go over that as well. It's just another guideline for you to have on hand to look kind of back on as you're using the pump to understand the mechanism until you get kind of into the swing of it. So the beginning of your treatment, phase 1, which is the first 30 minutes, is your preparation or decongestion phase. What that means is we basically have to clear out the lymphatic system, clear out the pathways, so that we can make drainage of the accumulated fluid move a lot more efficiently. So that's actually going to begin in these pair of shorts. Your therapy would begin in the shorts, work there for about 5 to 7 minutes. Then it's going to move up to your chest, just work here for a little bit, and then it's going to go in your bicep, then in your forearm, and then your hand region. Each section is about 5 to 7 minutes depending on size. That is your first phase. So that's your first 30 minutes is that sequence, starting in the center of your body, working down sections of your arm. The second phase is your drainage phase. That is when we start at the hand, the fingertips, and work up the arm, across the chest, and down to the trunk. Now that we have cleared out the pathways with phase 1, we can efficiently drain that fluid from the fingertips, up the arm, across the chest, and down the trunk to other healthy lymph node groups. So 2 phases, preparation or decongestion, and then drainage. This is the same type of protocol that a therapist would do in clinic. Sometimes theirs is slightly different based on each patient situation, and they have kind of an hour to be the most effective. The point of Flexitouch Plus is to help you as the patient manage and maintain your condition long term. A lot of patients are taught self-MLD techniques with the therapist, which is just the therapist teaching you how to do that massage yourself. One thing that we kind of lose with that is a little bit of compliance, just because doing self-massage is not as relaxing or comfortable. It's also time-consuming compared to you having like a set-aside time during the day where you're going to therapy, or once you come home, sometimes there's 10,000 things to do. So Flexitouch Plus becomes kind of your tool to allow you to do this on your own. Another thing I like to talk about is the controller. A lot of people go, oh, I don't know if I want to push all those buttons. Flexitouch Plus will come programmed for you based on your situation, which we take care of on the back end. So this controller will come all pre-set up for you. Your goal is to be able to turn it on and hit enter. It will roll from there and do everything it needs to do based on your treatment plan. It does have a timer on the front, so you do not need to time yourself. It will count down for you and go from there. Once it's done, it'll automatically stop. If you were to be asleep, it would eventually just time out and shut down. But it will just tell you session completed, and then you can turn it off and you're done. So I'll show you how to take it off. When you're done, you would just put your hand, I usually use this pocket in the front, pull down, which prevents patients from grabbing all of this Velcro. So I say use that one piece, slide this off. Your shorts are just gonna, same thing, open the pocket and drop them like you would just be taking off a pair of shorts. Other little questions that I always get from patients is, what do I wear? So I always recommend lightweight, loose-fitting clothing. Whatever you're comfortable in is going to be best. It's also going to make it easier for you to don and doff these garments when you just kind of have comfortable, lightweight clothing on, nothing too bulky, nothing heavy that would kind of make that fit a little bit tighter, for instance. Another thing is positioning. Do I have to be laying down? Can I be sitting up? Can I be moving around? This machine is plugged into an outlet, so you cannot be moving around the house while plugged in. So we want you laying down if possible with the extremity elevated. Also think about maybe like a recliner position with that arm elevated would be good. But we want you kind of as flat and stretched out as possible. The reason being is it kind of eliminates gravity, which helps fluid move a whole lot easier when this machine or therapy is working. Same thing as if you were in like a PT clinic getting this treatment done. They would have you typically stretched out on kind of one of their nice PT beds, talking, doing the therapy. So you can watch TV, you can sleep, but the goal is for you to kind of be in the best position to have the most optimal treatment possible. Another question is, do I have to get these garments set up on my own all the time? No. So we provide a training to the patient once you have your device that's been delivered to your house. Right now, we are doing a lot of those trainings in a virtual way or over the phone, just because we're limiting face-to-face contact to protect everybody's health. But on a normal basis, or once restrictions are lifted, that patient would have a in-person training, and we would get all the garments fitted to you to make it very easy for you to put on and take off, and make sure you're comfortable using the controller, knowing how they should fit, all that good stuff. So with all of this going on, not really the ideal situation, but I did want to kind of go over some basics so that you as the patient knew what a demo consisted of. But I look forward to hearing your questions. Welcome your questions, and please reach out with anything that I can help with. Watch this as many times as you need, and we will talk soon. Thank you.